Good morning, everyone. It is Monday, the 29th of June. My name is John Benko. I'm the Director of Nursing here at Belfair, and I'm coming to you via a recording. You're on Zoom with our orientation program, led by the HR team who are coming to you out of the training center. And normally I would be down there with them, but I've got an appointment at the very same time, so I'm going to have to miss it for that meeting. But please, I'm hoping that I can get the same points across to you and welcome you. We certainly appreciate you being here and joining our team. As I mentioned, my name is John Benko. I am the Director of Nursing. We have a health clinic here on the Belfair campus in Shaker Heights, and that's where my building, E, is where my office and the clinic is located. We have about 18 or so nurses who provide medical support for all of the residents, somewhere between 85 and 90 residents at any given time. And we make sure 3 times a day, if not more, we get the meds out to the clients, make sure that their medication is compliant and as ordered. We work with our psychiatric team here, as well as the primary care providers for those clients. We also help organize any outside providers as they might be necessary. We do have the Wooliger Wellness Center here on campus. There's a mid-level provider who is there. If any of our clients needed to be seen, we would make that recommendation or send them out to an appropriate specialty. So that is what happens in the wellness, in the health clinic. We also manage a flu shot clinic every year. You'll be hearing about that in the months to come. This is going to be a very important year for flu shots. So prepare yourself for many messages about flu shots, and I hope you'll take advantage of that great benefit offered by all the Wingspan affiliates, and that is that free flu immunization. That is essentially a very small view of what happens at the health clinic and what we do. Some of that responsibility was enlarged earlier this year with the advent of the global pandemic of the coronavirus. So since that onset of COVID-19, we're also working with the leadership team here, HR, as well as risk management and the residential teams, as well as all of our programs, to make sure that everyone is as safe as possible. One of the ways we're doing that is to try to sift through the information that can be overwhelming and get it out to you in a form that you can use it and as often as we need to. And we're doing that via videos. Some of those videos are available on the portal. So when you get to your workstation, make sure you talk to your supervisor on how to get to the portal. You'll certainly learn that today, and you'll see there's a COVID-19 update. So if we have information that is pertinent, we will get it out. If there's additional training we have to do, we'll get it out either on the portal or to those specific areas that need it. And we also have instituted protocols in place. So since the COVID-19 crisis started, we've had a handful of employees who have come down with the infection. We've caught them either by screening or they've reported it. We've worked with the health authorities, and I think at this moment, everyone is back to work. I think there may be one person who works in one of our satellites who's still off. It's been a very low number, and we're very happy about that, of course. A number that we're equally happy about is 0, and that is the amount of clients who are in residence either here or at our Applewood Center who have come down with COVID-19. So we've been able, very fortunately and very luckily, to have none of our clients infected. One of the ways that we're doing that is, of course, through information. The other way we do that is through our protocols. So we're screening everyone who comes onto any of our properties, and that includes all of you. So when you get to your work area, just like I did this morning, someone will ask you a series of questions regarding your health, and those questions simply point out some symptoms that are concomitant to folks who have COVID-19, and we want to make sure if you have any of those symptoms, we don't have you on campus. We're also taking your temperature. I took my temperature this morning like I always do. When I came in, our health screener here in the health clinic took my temperature. It was 98.2, a little warm for me. Could be the shirt, hard to say. But in any event, we're making sure no one has any symptoms, and if they do, we're going to ask them to stay home. One thing that's not new, but we're going to reiterate it, and that is if you're sick, stay home. Do not come onto campus. Do not go into your work area. We don't need other employees coming ill, and we certainly don't want anyone bringing COVID-19 to any of our team members or any of the clients. So screening is terribly important. We use hand hygiene just like everyone does. We like to stress that, so you always want to have good hand hygiene. Physical distancing, whenever you can, you need to stay 6 feet apart. We've lowered the capacity in many of our, in all of our meeting rooms, and we've switched many meetings to be remote. So whenever you can do a meeting remote, please do so. Try not to get into large groups of folks, and then again, you need to use physical distancing whenever you can. I'm in an office by myself, just like if I was in my car by myself. I'm not wearing a mask, or a face covering, I should say. Anytime I'm anywhere else, I'm wearing a cloth face covering. I have several. I'm sure you have several as well. If you need one, talk to your immediate supervisor or your divisional leadership. We'll make sure that you get a cloth face covering. Anywhere you are on campus, if you can come in contact with someone else, you need to be wearing the cloth cloth face covering. So these cloth masks protect each other. In other words, I'm wearing a mask to protect you. You're wearing your cloth mask to protect me. That's what those masks do. Early on, there was some controversy around whether these masks would work earlier this year. We're finding great science. A couple of studies just came out over the weekend. This is exactly how to prevent folks from spreading the COVID-19 virus. We're seeing that most of the COVID virus is spread from person-to-person contact, and that's people being in close contact, which is less than 6 feet apart, and sharing their germs, either through coughing, sneezing, talking. And the way that we're going to prevent that is keeping up social distancing and also wear your face covering. So that's mandatory. You'll hear me remind everybody quite often. If I see you without one, I'll ask you to put it on. And I think it's just good common courtesy. And we know it's also a good part of our protocol. So physical distancing, hand hygiene, sanitize your areas. There's wipes available. If not, again, talk to your leadership. Make sure you can clean your workspace. We have environmental services here. They're doing a great job, but we need to bolster that. Again, science has shown us that if you keep up on your own workspace, it lowers the propensity to have viral or bacterial contaminants by about 85%. So we appreciate the help there. If there's any questions that you have, or if you think you need some training or some guidance in something specific to COVID-19, talk to your supervisors. There's a good chance this information has already been disseminated. As we get good information in, we sift through it, we talk it over in leadership, and we make sure that we're following the best practices. We are in constant communication with the local health authorities, and we also sit on several committees and join many calls and conferences of local health leaders from the two very, very large health systems here, as well as many of the local providers. So we are getting the information just as quickly as we can. And as it pertains to our practices here, we make sure we have our best practices coming out to you. Again, we have videos available, not unlike this one. They will be on the portal. And if we have some specialized training that we need for any individual team or division, we'll make sure that we get a video or some in-person outreach to you as well. That's all I have. I want to welcome you again, remind you all to bring your face coverings, stay away from each other, and as you'll hear me say many times as you watch videos or bump into me, please wash your hands and stop touching each other. Have a great day. Welcome.